New South Wales paramedics and patient transport officers are on strike for 24 hours as workers demand faster action on the state government's promise to scrap the wages cap. Danica DiGiorgio is in Sydney. Danica, it will affect patients leaving hospital.
Kieran, the workers will refuse to take discharged patients from hospitals to home, residential or aged care facilities as part of this 24-hour strike action, which is due to end at 7 a.m. tomorrow morning, although patients in end of life as well as dialysis will not be impacted. The strike action is over the state government's promised plan as part of the election campaign to scrap the public sector wages cap. The union says there's yet to be any discussions on that plan.
There is no movement in relation to 500 paramedics. There is no movement in any wages. There is movement in paramedics leaving, and they're not the only ones. Allied health professionals are leaving as well. So I have never been in a situation like this in the past decade where there is no engagement.
The union says it will not stop this industrial action until members get what they believe they deserve. They've also issued the Premier with a list of 6 demands, including a pay rise of 6% plus 0.5% superannuation. But Premier Chris Minns has hit back today, saying that negotiations are indeed ongoing.
As we've said many times, we're committed to removing the wages cap. It's important to do that in a legislative way. We have made progress in terms of our negotiations with public sector workers, not with every union that represents public sector workers in New South Wales. I'm not proposing to have a chapter and verse, running commentary about those negotiations until we reach an agreement.
Kieran, the union says negotiations stalled under the previous state government, but is yet to hear from the new Premier Chris Minns.
Danica, thank you for that.